Ready to roll? Perfect. Well, good afternoon, everyone. My name is Zain Ismail, and we'll get into some introductions here in a second. But today, Taryn and I want to come with you from Henry Ford Health System to present to you a little bit on our opinion on where we think there are opportunities in innovation here in healthcare. So thank you for being with us all day, and we know we're your last presentation before we close this out. So we'll be brief, and we'll keep this very conversational, and we're very excited to hear some of your questions as well. So let me advance this, make sure we're working. So like I said, my name is Zain Ismail. I currently serve as a transformation consultant here at Henry Ford Health System. Henry Ford Health System is one of Southeast Michigan's preeminent integrated health systems. We have 5 hospitals, including Henry Ford Hospital, which is pretty popular. You've probably seen it driving by right downtown Detroit. We're also an integrated health system, so we have about a 600,000 member health plan, the Health Alliance Plan of Michigan, and we serve approximately 2 million patients across Southeast Michigan. What's really unique about us too is we actually have a very cross-border workforce. There's about 800 Canadians on our staff, primarily nurses, and then some administrators like myself. Taryn, who are you?
Great summary, Zane. Hi, my name is Taryn Simon. I'm the Director of Innovations at Henry Ford Health System. A little bit about innovations. We were created almost a decade ago with the goal of advancing programs, products, tools, and technologies that will improve the lives of our patients. Our team leads technology management efforts where we work with our internal innovators to bring their ideas and designs to life with the goal of commercializing these new technologies. But we also identify opportunities externally with early stage companies and mid-sized companies where Henry Ford may be the clinical partner to co-innovating technologies. So Zane, should we get started?
Absolutely. So in terms of our agenda today, and I made myself a note, we want to talk a little bit about the changes that are occurring in our industry. We want to summarize all that and really talk with all of you about what we think the opportunity is, at least from our perspective, leading innovation and transformation in a provider-based institution. We want to share a few examples, some that are happening internally, but just some that we're aware of in the market. And certainly many of you would actually fit into these buckets when you see them. And then finally, we want to keep it very open to questions. And then we will not forget to thank our sponsors and all the wonderful people that help us put on this virtual event. As you know, we've had to innovate our own game here, and usually we bring this event to you guys in person at Ford Field, but obviously we're doing it online. So we want to thank everyone that's been a part of that. So in terms of where we see opportunity in health systems, there's really 3 big buckets of things when I try to summarize it to make it really simple. And really it's everything that's going on in terms of changing demographics, which we'll get into. Populations around the world, in Canada and the United States, are changing in some sense, a lot different than what they used to be. We're seeing huge changes in our industry dynamics, especially as many innovators like yourself step into the marketplace and give us a run for relevance, I should say. And then finally, black swan events, so things that we weren't exactly prepared for or didn't exactly see coming, things like COVID we'll talk about, increasingly are a plague, if you will, to our health systems. So we'll talk about those. And so I'll turn over to Taryn to talk about changing demographics.
Okay. As Zane mentioned, changing demographics is a large factor in the importance to change how we approach healthcare. I'll start with the human capital shortage. With rising demand for healthcare services, it becomes increasingly difficult to recruit physicians, nurses, and other specialties. It will also become difficult to recruit top administrative and IT talent as other disruptors enter the marketplace, as we'll talk about in the next slide. Another factor in retaining key administrative talent is that geographic boundaries may no longer be relevant, as many roles now are working remotely, at least now and as well as the foreseeable future. Moving on to the rise of chronic diseases, while at the same time it's difficult to recruit talent, we will see an increasing demand on healthcare services as a result of the rising instance of chronic diseases, mental health, and also addiction challenges. With the changing economic conditions here, we need to leverage technology. That'll be a key word today to enable all demographics to engage with care providers in a different model. How many patients can monitor their chronic conditions at home? These are questions that we ask ourselves. How can we empower our patients through virtual visits with their physicians? Keeping patients well at home will be imperative as we look towards the future. And finally, increasing lifespan, decreasing health. Thanks to innovation in therapeutics and care models, humans are living longer but not necessarily healthier. We at Henry Ford, at least, are looking at different models on how to change this by rewarding healthy habits and encouraging the uses of products, such as wearable devices that will track healthier steps to longer living. Education will be paramount in this space, as well as patient engagement, aimed to keep them out of the hospital and ambulatory settings. So really the key takeaway here is that there's a huge opportunity to use digital tools to maximize the reach of our current clinical workforce, to better manage chronic diseases, and to influence our community to live healthier lives and therefore longer lives. Zain?
Thank you, Taryn. So next we'll get into, let me click here. There we go. Changing industry dynamics. A big thing that we're noticing in healthcare, and certainly many of you have heard about it before, is sort of this notion of consumerism that's finally starting to enter our industry. And this is the idea that healthcare consumers, and I say that intentionally, not the term patient, but healthcare consumers increasingly have more and more choice when it comes to procuring health services, especially services that are highly commoditized. So things like primary care, things like urgent care, potentially things like behavioral health and mental health and addiction services. So people want choice. People, there's many different players out there now in the game. But it's also an economic thing where increasingly, especially here in the US, with the advent of large or high deductible health plans and copays, more and more now at the point of care, patients and health consumers are being expected to pay something. It could be a small fee, it could be a large fee before they procure the service. And what happens is when you start to introduce a cost at the point of care, it starts to change consumers' behavior. And so that's a big thing. So it's both the economic and then also the experience. I should also mention that in single payer systems, perhaps not in Canada, but elsewhere in Europe, they are experimenting with point of care payments and copays. And so it's not just a product of US style healthcare, it's kind of everywhere. And then similarly, the other piece to this coin is this notion that health consumers and patients are being trained by other industries and how they want to experience service. And so we're no longer competing just against our last best healthcare experience, but we're competing against the last best experience, period. And so if you fly with Air Canada or with Delta, or you check into the Marriott, you can do it all virtually. You can all do it through your app. You almost never have to see a person. You can pay for things online. You can reach out for help online. Unfortunately, all those tools don't always necessarily exist in health systems yet. We're getting there, and we certainly don't have that level of experience yet. However, we're getting there. And so that's a huge competitive threat to us, especially as we think about new entrants and disruptors. Many of you who are on this phone call who are coming up with very cool, largely digitally enabled services and products who do have that acumen and do have that experience and are really giving us, I guess, a run for relevance, if you will. And so, like I said, these digital first startups continue to come to the healthcare market, both in Canada and in the United States, and really offer this new level of convenience and access to care that traditionally legacy health systems like Henry Ford, like Windsor Regional, potentially have not been able to offer, although we are making strides in that space. And then something that's very concerning to me, particularly someone who's a little bit more involved in strategy around how we position ourselves, is really this emergence of platforms. So they're digital disruptors who have the right experience, who work to aggregate both, call it the customer and new services all together in one. So I think about groups like Amazon, groups like Google, groups like Walmart, who are starting to come into the space to offer things like primary care, where potentially it has a huge opportunity to disrupt us and those that have been here for this whole time. And we'll get into here in a second to talk about some platforms. But I think about groups like Sam's Club, who just announced that they're going to give to their members for a little bit more of a fee per year, $1 primary care visits. I don't know how we're going to deal with that one, Taryn. We'll have to put our heads together to figure out how we stay relevant when prices like that start to drop. But it's a very interesting time in healthcare. There are press releases going out every day about the changes that are coming and the new people that are joining us in this space. When it comes to examples of emerging platforms in healthcare, just to hit home the point a little bit more, there's a couple big ones ones in the US we're seeing come together, and both of those are being led by large national telemedicine providers. So the first one is American Well, which recently announced a partnership with Google Cloud and subsequent investment. They'll be running American Well over Google Cloud, and American Well also is partnered with Cleveland Clinic to do specialty consults in high acuity care. We see groups like Teladoc, who's similar to American Well, purchased Livongo, and Livongo acquired Magellan. So right there, they're coming up with a play around mental health and addictions and chronic disease management. Many of you on the phone call, or many of you on the call today are listening, may want to consider getting acquired by some of these guys and becoming part of their platform. And then also in Canada, we see the same. When I speak with my colleagues, and I am a Canadian, when I speak with some of my colleagues over in Ontario, they think that all this disruption is only in the US. It's not, it's coming everywhere. And so we see groups like TELUS Health, which is a national mobile services provider, partner with very reputable international Babylon Health. Recently, we see Shoppers Drug Mart, that's owned by Loblaws, the large national grocer chain, come together with Maple Health. And so there's some really cool models emerging in healthcare that we're all going to need to be watching and see where the chips realign in this space. Taryn?
Okay, well, switching gears to Black Swan events. As we know, the year of 2020 has certainly been one of unexpected change for everyone, including health systems, with the Black Swan event of COVID-19, which is a huge example of how things change very quickly, and we have to adapt to it. And I'll just give a few examples. As the COVID-19 pandemic peaked in March, Henry Ford responded in numerous ways throughout the community, not only working with local manufacturers to source, vet, and co-innovate PPE, resulting in sourcing over 1 million pieces in the height of COVID, but we also looked at the community to say, okay, what can we do to keep you at home healthy if you have this COVID pandemic. So we created and distributed, I have props, COVID care kits that allowed people who were diagnosed with COVID to safely monitor themselves at home. The kits included tools such as the pulse oximeter, thermometer, and other items, as well as a dedicated phone line for patients to directly connect with a clinician if needed. So, thinking forward in how we can help our patients de-stress, and as the pandemic continues, there will be a continued need to social distance, right? This has forced our health systems to think differently on creating flexible and agile care delivery models and what will become the new normal. As Zain referred to, airlines, I never thought that, I would, after, such a huge event as 9/11, that I would be going through, security devices for the rest of our lives, but it's the new normal and it's what we expect. So that same idea has to translate to healthcare, and we have to create what will be our new normal. So, with increased consumer anxiety in mind, digital technologies will continue to advance, allowing our patients to communicate with clinicians, again, in a virtual environment, as well as, how we grow the landscape of what a hospital at home model will succeed for patients managing chronic diseases, using key remote monitoring, patient equipment, and then connections back to the clinical care team. So the emergence of low-touch economy favoring the digital transformation will actually pave the way to new models of healthcare in the future.
Thank you, Taryn. So just summing this all up, because I know we just chatted for about 10 minutes and buzzwords. And so to bring it all together so it can make sense for all of us today, there's really sort of 4 big opportunity areas. And when we talk through everything we just talked about. So the first is, obviously, we have an opportunity now to reimagine the way we deal with our services, to radically improve the patient experience, increase the convenience and timeliness of care, and then also increase the effectiveness and appropriateness of care. We also have the opportunity to use digital tools largely to maximize the reach and augment our clinical workforce. And I want to bring up that's actually very important, as Taryn mentioned. If things continue to be remote and people work digital, geographic barriers drop. And so even for non-clinical administrative staff that actually do serve some pretty essential roles in health systems, those people are now, subject to potentially the emails from recruiters from, places like California or Austin or wherever. And so it makes an interesting challenge for us when we think about our talent strategy and how do we make sure that we have the right workforce for the future to bring us there. We have the opportunities to use digital tools to better manage chronic disease and influence our community to live healthier lives. So moving away from just serving patients at the point of care, but also starting to think about influencing them at the point of thought, at the point of activity, and at the point of consumption. And then finally, a big one that we've learned is we have the opportunity to strengthen our health system resilience and agility and really refine the ways in which we work to make sure that we can focus on doing what needs to be done today, but also thinking about what needs to be done tomorrow, which can be very, very difficult for teams to accomplish. Usually you're either one or. It's hard to tick between both. And that's why we have dedicated innovators like Taryn and her team that focus on the future. So the rest of us can do a little bit more of the worry about the today work. So in a nutshell, those are the ways that we think about the big areas of opportunity. And I hope that as you're listening to this presentation, that there are many of you with the technologies and tools and startups that you're working on can see yourself in some of these big buckets. So maybe getting into some examples. So Taryn, why don't I turn over to you to talk about a few examples that you're familiar with?
Sure.
And then you can close it out.
Absolutely. So as we look at the first point, as you mentioned in the last slide, reimagining the way we deliver our care services. So what is the business model going to look like in the future? How are we going to bundle ourselves, knowing that we need to morph and change with bigger industries getting into healthcare space? And then, looking at home-based models of care, as I mentioned earlier, and remote patient monitoring. So, with the COVID pandemic, that really accelerated, the kind of care that we want to emulate for our patients. We're looking at patient populations, again, who could be monitored from home, not just with chronic diseases, but those who go to the ER. And instead of admitting these patients, how can we successfully discharge them with the right tools and resources at their fingertips? Maximizing the reach and augmenting, our clinical workforce, very important with collaborations with companies like TidalCare. I'm going to jump down to the bottom where we refine the ways in which we work. Here at Innovations, we work with, we've identified areas where we can utilize 3D printing as a new way to plan for clinical procedures. So for example, we have identified a gap in cardiovascular or structural heart department in pre-procedural planning. Our innovation team worked with the clinicians to model patient CT scans and 3D printed models just like this that will be able to replicate the heart, and the clinicians are able to use this as a tool to prepare for surgery that will allow better placement of medical devices. So this is something that's become a new standard of care. And as a result, software was developed and licensed to industry. So those are some of the ways that we are expanding our specialties and innovating in this space.
Thank you, Taryn. Yeah, just add, by the way, some of these things on our slide are things that we are doing and just some things that we're aware of. I'm not necessarily associated with Henry Ford. And so one of those companies that I really enjoy is Blue Dot, based out of Toronto, that's been doing a lot of work in helping organizations predict and understand, where, certain diseases might, come from, or, what warnings you need to send out to organizations. And I wish we had Blue Dot before COVID had started, but they're a great example of tools that health systems can use to build up their resilience and agility. And I know they're doing tremendously well, again, based out of Toronto. Some other work we're doing internally, again, to think about refining the ways that we work is we've actually spent a lot of time with our human resources team really thinking about how do we position our human capital for the future of healthcare as skills are changing, I guess market demands are changing like we talked about, there's really a whole different type of leader now that we need here at Henry Ford Health System. And we're starting to put together the pieces to figure out what those are, and then also recruit the talent and potentially steal them from, shouldn't say steal, but borrow them from some of our other collaborators. And a huge opportunity for us is really just to think about upskilling our workforce, both clinical and administrative, to really get more comfortable with technology, using it, understanding it, have a working knowledge of it, and understanding its strategic importance. And so to Taryn's point, COVID was actually a great learning to see who could at least navigate using video conference software. And unfortunately, there are some people who couldn't, so we had to help them out. So yeah, those are some things that we're looking at. And as it says there, we're looking at putting together a 10-year talent strategy that's going to help us navigate all these interesting waters that are before us. So I think that closes it out. I think what we wanted to do is get to some questions. So we're happy to answer them. But before we get there, I did make a reminder that we wanted to thank our sponsors before we lose everyone. And so big thank you goes out to Pure Michigan Business Connect for helping us put this on today. Big thank you goes out, it looks like to us, Henry Ford Health System and the Innovation Institute for sponsoring. Into Being and Jean and that whole team, thank you so much. Yvonne Pilon over at We Tech Alliance, thank you for your support and continued support from the Windsor side. And we also want to let everyone know that we'll be sending out a survey at the end of this to get your feedback on how things are going. And then we also wanted to thank Kristen and James, who are behind the scenes helping us with the tech. I know we've had a few challenges today, but if it wasn't for them, we wouldn't be able to put this on. So thank you so much, Kristen and James. And so we'll take your questions.
Mm-hmm. We did have an interesting question come through, and that I'll answer. The question was, with our current state of COVID and changes in medical care, how do you see emerging technologies such as AI and machine learning being accepted and transitioned into emergency care? Now, that's a great question. It's one that's asked of us all the time. And really, by looking at historical patient data and incorporating AI and machine technology, we're able to better understand our patient footprint. And that's enabled us to look, be on the cutting edge. By understanding our patient data, we'll be better positioned to provide custom care based on their individual needs. And as a result, our providers will be better equipped to execute a comprehensive care plan, and our system will be better ready to serve the community needs, whether that's during another pandemic like COVID or a leading transformation in healthcare. So thanks for the good question.
Do we have any more questions? James or Kristen? I know they're standing by. Put them right into the chat and we'll see them come through. In the meantime, if anyone has any private questions of us, our emails are here. You're welcome to shoot us an email and get in contact with us through email or LinkedIn or Twitter or snail mail, or we'd love to have you all for coffee, but we can't do that just yet, maybe in a year or two. All right, well, it doesn't look like we have any other questions. So I think with that, we'll sign off. And again, thank you on behalf of myself and Taryn. I should have mentioned, we're also part of steering committee members for MedHealth. So we thank all of you for being here and participating. And we hope to see you again next year. Let's hope it'll be in person this time. Let's hope so. And again, thank you to our sponsors, and James and Kristen, thank you so much. Have a great day, everyone.